Good morning, everyone. I'm Kimberly Chalia with PHCA. Thanks so much for joining us for today's webinar. A few quick updates to share before we get started. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit. For those who provided a NAB number, credits will be uploaded within the next 2 to 3 weeks. As we begin today, all attendees will be in listen-only mode. Please feel free to submit your questions via the chat icon at the bottom of your screen, and we'll make sure to answer as many of those questions as possible at the end of today's presentation. And now I'll turn it over to Malka.
Okay, thank you so much, Kimberly, and good morning to everyone. Welcome. Thank you so much for having me. Thank you for joining. My name is Malka Trump. I am a CPA, a CPP, and the Director of Compliance at Viventium. And today we are going to talk about payroll compliance and pay strategies for post-acute care. So just a bit about Viventium. We have over 30 years of experience in the payroll industry with a specific focus and specialization in the healthcare space. We onboarded our first health services client back in 2005, and today we pay over 424,000 healthcare employees with our payroll service, while still maintaining a 93% client retention rate. And we have developed a full suite of payroll and HR software solutions really to address the specific needs of the post-acute care industry. Just a little note here before we get started. Viventium's not in the business of providing legal or tax advice, so this webinar should not be taken as legal advice. It's for informational purposes. Of course, always consult with your legal or tax advisor before you make any changes, whether financial, tax, or HR decisions. And this webinar is also based on currently available information, which may, of course, as we all know, change at any time. And finally, no part of this presentation is an expression of a political opinion. So with that, let's get started with our agenda for this session. We are first going to take a look at one of the most recent and potentially highly impactful developments, the new proposed U.S. Department of Labor overtime rule. We're then going to continue with a look at the latest Form I-9 and the changes, as well as the new alternative procedure for employee verification. Then we're going to move on to pay transparency laws, which are becoming increasingly popular on the state level and really affect the way that you recruit your workers. We're going to then discuss a big item in the healthcare industry, employee classification, the complexities, as well as the latest regulatory developments. Next, we'll take a look at some key 2023 compliance trends. And we'll finish off with some key pay strategies to increase worker retention, which is always a top priority in the healthcare space. So let's get started with the first item on our agenda, the United States Department of Labor proposed overtime. So just a little background first. I'm sure many of us are familiar with the current FLSA regulations, how in order for an employee to be exempt from overtime, they have to meet certain duties tests, they have to be paid a minimum salary amount, and they, of course, have to be paid on a salary basis rather than hourly. Now, all those amounts, the salary thresholds that we are familiar with, are potentially going to be changing in the not so distant future. So on this slide, you can see that the salary threshold that an employee needs to be paid on a weekly basis in order to be exempt from overtime is currently at $684 a week, which translates into $35,568 a year. And that has been in place since January 1st of 2020. So if an employee doesn't earn above this on a salary basis in a week, then their employer must track their hours and pay them overtime, regardless of their job duties. Now, under the Department of Labor proposal, that salary threshold would undergo a significant increase to $1,059 a week or $55,068 a year. Really quite a big jump. Under the new proposal, non-discretionary bonuses. So if an employee earns bonuses, maybe certain incentives, that can still count towards 10% of that salary. But what will potentially change is an increase to the salary threshold for highly compensated employees, or HCEs. That threshold would increase from $107,432 per year to $143,988 per year. So again, that would potentially change as well. And the proposal also says that future increases will happen automatically every 3 years, which is much more specific than the current kind of vague language that we have now under the current regulations, where changes will be made more regularly. So if this proposal does go through, we can expect some sort of more frequent automatic increases to these salary thresholds, which we haven't seen recently. I believe the last increase before the 2020 was probably 10, 15 years before that. So we might see this as more of a common update in the future. So why is this so significant, especially in the post-acute care industry? Well, the Department of Labor estimates that 3.6 million workers will become eligible for overtime for all those hours worked over 40 under this new proposal. So they're not eligible for overtime now based on what they earn. But if this proposal goes through, 3.6 million more workers, 600,000 of them are expected to be healthcare workers. And that is because all those workers now that are being paid between 684 weekly and 1,059 weekly, and they meet the duty test, they're currently not getting overtime. But under the new proposal, they would, because they don't meet the salary threshold. Of course, it is also possible that under the finalized rules, these thresholds may actually increase and be higher than the proposal, making even more employees eligible, because it's expected that the final threshold amounts will be based on earnings data at the time that the final rule is published. So what happens next? The Department of Labor had a 60-day comment period where they were receiving comments and suggestions, lots of information about this proposal. The deadline has passed for those comments. It was November 7th. I recently read that there was over 26,000 comments that were received by the Department of Labor. So now their job is to take all that information, review it, revise, and then release a final rule, which will go into effect 60 days after that rule is published, likely sometime in 2024. So definitely something to keep an eye on. There might also be some court challenges to the rule, so we'll have to see how that will affect both the time frame and what the final rule will look like. Okay, so yes, definitely a lot of things kind of in limbo here. Let's move on to the second item in our agenda, Form I-9 and its recent changes. So let's just start with a little bit of background. In our pre-COVID world, if we remember it, when an employee was hired, Form I-9, of course, had to be completed, and the identity and employment authorization documents that are required to be submitted by every employee to verify that they're eligible to work in the United States, whether it's their passport, their visa, or social security card, had to be submitted and verified with a physical in-person meeting. So that had to be done with the employer themselves or with an authorized representative of the employer. Come COVID, and our world changed drastically. An in-person inspection was not possible in many situations. So the United States Citizenship and Immigration Services, USCIS, established COVID-19 temporary relief, flexibility, and effective March 20th of 2020, they allowed electronic remote inspection for this documentation. That flexibility ended on July 31st of 2023. And there was also a deadline of August 30th, 2023 for all employees who had been inspected remotely for their employers to go back and do that physical in-person inspection. Potentially a really large task for employers, some of whom may have hired hundreds of employees during that COVID-19 flexibility. So partly in response to this, as well as the need for changes to this process in general due to our new post-pandemic world, on July 21st, the USCIS announced the release of a new Form I-9 and an alternative procedure for verification. So let's start with the Form I-9 changes. We'll just look at them quickly. The form really went through a big facelift with many changes and kind of a simplification. So it reduced the form to a single sheet. It made that form fillable on tablets and mobile devices, moved some pages into standalone supplements, like there's specific requirements for a specific situation, rather than that be on every Form I-9, it's a supplement now. It brought in the list of acceptable documents, included additional guidance, reduced instructions from 15 to 8 pages, and notably for our discussion today, it added a checkbox on the form for this new alternative procedure for verifying employees' documentation remotely. So let's take a look at this new alternative process, this new alternative procedure. Before we go into the details of what that process is, it's important to note that in order for an employer to be eligible to use this, they must be enrolled and in good standing with E-Verify. E-Verify, the service to verify employment authorization documentation. So if an employer is not using E-Verify and they want to be able to do remote inspection for Form I-9, E-Verify is something they need to consider, they would need to sign up for and start using. Right now, if they're not using it, you have to do that physical in-person inspection. There hasn't been talk about broadening that remote inspection, even to employers who don't use E-Verify, but right now that's not the case. So let's just look at this procedure. Within 3 business days of an employee's first workday, the employee has to transmit the front and back, if the documentation is two-sided, their copy of their identity and employment authorization documentations to the employer. So let's say that's by email or whatever method they're sending it over electronically. The employer would then examine it, both sides, ensure that they reasonably appear to be genuine. The employer would then conduct a live video interaction with the employee, who would then present the same documentation that they had before. The employer would look at it again and ensure they reasonably appear genuine and relate to that employee. The employer would then, of course, check that new box on Form I-9 to indicate the alternative procedure was used. An employer would have to maintain clear and legible copies of the documentation and make sure that they are available to a government official upon request. So let's just look at the timeline of these changes. The new Form I-9, if we remember, was announced back on July 21st of this year. On August 1st, the new form was issued and became available for use. October 31st was the last day that the old version of the form could be used. As of November 1st, all employers must use the new form. So if you're not already using it, if it's not part of your process, now is the time to update your processes and make sure that you're in compliance with this requirement. Okay, let's move on to our next very trendy compliance topic right now, pay transparency laws, which have been sweeping across the nation on a state level. So pay transparency laws, as I said, have become increasingly popular. And there's also, beyond states, a number of cities who have also passed laws. And though, of course, the specific requirements of those laws are going to vary by state or by locality, in general, some of the requirements we see include the requirement to disclose pay or pay ranges for a specific job or role that is posted. They must disclose pay ranges for internal promotions or transfers. To provide a pay scale for current employees, that is required in some states. Some states require that employers disclose with their job posting what are the employee benefits in the job, and in some cases disclose if the work can be done remotely. What are the stated goals or benefits that are thought to be behind pay transparency laws? Like, what is the point of all this? Why is this becoming popular? Why are states jumping on this bandwagon? Well, one of the main stated goals is that it is thought that pay transparency improves pay equity, and specifically to improve gender pay equity and reduce minority discrimination. Because if information on pay for specific roles is available and transparent, it is easier to identify systematic pay inequities. And it's also easier for workers to demand equal pay because they know what is the going rate, what everyone else is getting, what they should be getting. When hiring new staff, employers should therefore be ready not only to meet the letter of the law, like what's the required pay transparency posting requirements, but they should also become prepared to face questions regarding pay, company compensation practices, information on how the employer determines how pay ranges are set up and what data is considered. Because this is becoming a important topic that employees really want to know information and they want to ensure that they are getting fair pay and they want to understand the process going on behind what the determination of what their pay is. Pay transparency laws are also thought to lead to competitive talent acquisition. Because if you have to post pay ranges or rates, the employer is going to have to ensure that what they're posting is competitive enough to attract candidates. And the same goes for posting benefits offered as well. And finally, pay transparency is thought to build worker trust and confidence, which can increase worker retention. Definitely an important item to focus on. Retention is a big deal in the healthcare industry because if employees feel confident in their pay and that reflects their hard work, they're more likely to be satisfied with their job and loyal to their employer. So these are the states who currently have pay transparency laws, which either are already in effect or will be going into effect in the near future. As you can see, New York was the most recent state to go into effect in September. And Hawaii and Illinois are the latest states to pass legislation, and Hawaii will be going into effect in the coming year, and Illinois in 2025. And as I mentioned, there are some localities with similar laws, so it is important to be familiar with the requirements in the jurisdictions where you operate. Okay, so let's move on now to our next topic, employee classification. So as I'm sure many of you are familiar with in the healthcare industry as employers and trying to keep up with staffing demands, hire different types of workers, possibly some are employees, others are hired as independent contractors, and getting that right, determining whether a worker is an employee or an independent contractor is really no simple matter. And getting this classification correct from the very start is key to ensuring compliance and avoiding potentially large penalties for misclassification and underpaid taxes. The United States courts have considered many factors in deciding whether a worker is an employee or an independent contractor, and how to make this determination has evolved over time and is still evolving now as we speak. But right now, the IRS categorizes these factors into three main categories: behavior control, financial control, and the relationship of the parties. So it's important to take into consideration all these different factors because no single factor will provide the answer. An employer has to look at the broader overall picture, which is far from simple and in many circumstances not so clear and quite complex. So let's take a look a little deeper into each of these three categories. The first one, behavioral control. This shows whether there is a right to direct or control how the worker does his or her job. So if an employer has the right to direct and control the employee's work, that is going to generally indicate that the employer has an employer-employee relationship. And even if the employer does not actually direct or control the work, but they just have that right to, then that would indicate that that control is there. If the employer, for example, if a worker received extensive instructions on how the work is to be done, when, where to do it, what tools or equipment to use, all those indicate the right to control or direct. If the worker is determining how to get the job done, when to do it, what to use, that would indicate more of an independent contractor relationship. In addition, if the business provides a worker with training on required procedures and methods, that's generally also an indicator of the right to direction and control. Let's move on to financial control. Does the business have the right, again, the right to direct or control the business part of the work? Yes, indicates an employee. If not, independent contractor. But what does financial control mean? It means if a worker has financial control themselves, then he himself or she herself has a significant financial investment in their work. So they're not reimbursed for their expenses. They have the opportunity to incur a profit or loss from their job. So if these things are true, that generally indicates that they're an independent contractor because they have the financial control. Employee is generally not going to incur personal financial profit or loss. They're going to be reimbursed for expenses if they incur them on the job. Last category, the relationship of the parties. How the business and the worker perceive their relationship. If there is a written contract between them, generally that would be a significant factor in making that determination of what is their relationship, especially if it's difficult to determine based on other factors. So again, the employer is supposed to take into account all these factors to make the determination. Sometimes that can be difficult. If they do consider all the factors and are unable to, of course, they can consult legal counsel, but the IRS also provides a Form SS8, which an employer can complete and send to the IRS, who can then decide and make that determination. So why is it so important to get it right? And it's so important to get it right from the beginning because it has a major effect on how you pay your workers. On the payroll compliance end, if a worker is classified as an employee, the employer must, of course, withhold their federal and state income tax, as well as FICA, Social Security, and Medicare. And in addition to that, the employer also has requirements to pay employer taxes on the employee's pay. They have to pay their portion of Social Security and Medicare, as well as federal and state unemployment taxes. And they also must furnish an employee with a W-2 at the end of the calendar year. For independent contractors, generally, there is no requirement for a business to withhold taxes unless they receive a notice of backup withholding from the IRS. But generally, the independent contractor is responsible to make their own tax payments. They also pay self-employment tax, so they'll pay their own Social Security and Medicare tax when they file their individual tax return. And they can also deduct their expenses on Schedule C of Form 1040. And generally, they would be receiving a Form 1099. So again, this is a critical piece of the staffing puzzle, making sure everyone's classified correctly from the beginning. And then also you can back up your classification with documentation in case of an audit. Penalties can be high for misclassification. And then also if someone is classified as independent contractor and they're really an employee, there can also be an assessment of all those back taxes that were not withheld from the employee, not paid by the employer. The IRS does have something called a voluntary classification settlement program, which is an optional program where employers can voluntarily reclassify their workers for future tax periods. If they find an error, they can disclose that to the IRS, reclassify, and then get a partial relief from federal employment taxes. So it's like voluntary, but if you do realize you might have workers that have been misclassified and need reclassification, might be something to look into. Now, the United States Department of Labor, under the current Biden administration, has issued a proposed rule which would change the approach and factors for worker classification. So definitely something to be on top of, because how we classify workers might be changing once this proposed rule, which hasn't been finalized yet, it's still under review, but once the final rule comes out. And one of the stated goals of this proposal is to reduce misclassification of employees as independent contractors, to make it harder to misclassify them. Because an employee obviously has more basic work protections, like minimum wage and overtime pay, than the independent contractor. So what is the proposed rule? Well, under this rule, the consideration when determining employee classification is largely based on the economic realities of the relationship and whether there is something called economic dependence. If that economic relationship shows that the worker is dependent economically on the employer rather than them being in the business for themselves, that would generally indicate the employee-employer relationship. And there are 6 key factors to determine if there is this economic dependence or not. And again, the Department of Labor has said in this proposal that no single factor provides greater weight than the other, so they all need to be considered. And take a quick look at these factors. One, opportunity of profit or loss incurred by the worker dependent on their management skills. So what this does, it assesses whether the worker exercises managerial skills that affect their economic success when performing their work. So for example, if they can negotiate their payments, if they can choose to take or decline assignments, if they can choose to hire someone else to perform the work for them. Generally, if a worker can do those things, they're generally an independent contractor. If not, they would be an employee. Number two is an investment that is capital or entrepreneurial in nature. That means, is this worker investing in this in an economic way that they have a risk of profit or loss? That financial investment would generally indicate an independent contractor relationship. Number three, the degree of permanence of the work relationship. An indefinite or continuous relationship generally indicates an employee relationship. A relationship that is finite and for a specific period of time, or that is project-based, would indicate an independent contractor status. Number four, the nature and degree of control. How much can the employer control the work? Again, similar that we saw earlier. If the employer is controlling when they do their work, their schedule, how they do their work, would indicate an employee relationship. Number five, the extent to which work performed is an integral part of the business. So this means, is the function of this worker, is the tasks that they are performing essential to the business? This doesn't mean whether the employee themselves as an individual is integral, but rather the nature of their work is an integral of what this business does. Whether they do it or someone else does, we need this to be done because this is what our company does. When it is critical or central to the employer's business, that weighs in the favor of being an employee. When the work is not critical or central to business operations, that would indicate an independent contractor status. And last, the extent to which the worker's skills are specialized and contribute to the business initiative. So more specialized skills generally indicate an independent contractor. Less specialized skills, while more training needed from the business, may indicate an employee relationship. And again, these proposed rules, they take everything into account. They also say that additional factors may be relevant in specific situations and should be considered as well. So again, no easy way for this. It takes analysis and a review and really an overall broad look of a worker. But generally looking at these 6 factors, it would kind of be hard to imagine a situation where either a home health aide or a nurse, for example, would be considered an independent contractor unless they were working for a third party who contracts with the business rather than working for the employer themselves. Now, this proposal was issued back in October of 2022. So we've been waiting a while on it. The IRS did have a comment period until December of 2022. Then they said the final rule was going to come out in May of 2023. Then they pushed it off till October of 2023. We're still waiting for it. So we are going to see what's happening. Probably something will be coming out soon. But in the meantime, it's a good time to familiarize yourself with both the current regulations, if you're not familiar yet, and these proposed rules. Maybe do some sort of internal audit to ensure that all employees and independent contractors are classified correctly, and also determine if there might be some changes that might be needed and make notes about that should these proposed rules become the final rule in the near future. Okay, let's move on to our next item on our agenda, 2023 state trends. And we're going to talk about 2 popular trends moving across the country on the state level. First one being mandatory retirement plans, and the second, paid family and medical leave, both of which are very important to be aware of and on top of as you hire staff in various states across the nation. Let's start with our first one, mandatory retirement plans. Now, Americans just plainly aren't saving enough for retirement, and states are deciding it's time to do something about it. So they are requiring businesses to offer a retirement plan to their employees. Either the employer can establish their own plan or they can enroll employees in a state-sponsored plan. So, as an employer, what do you need to know? The employer's role is pretty simple. If they don't have their own plan already or they don't set one up, but they're required to have one, then they would have to go with the state plan. They would have to register with the state. They would have to auto-enroll employees and new hires in the plan. Of course, keep the employee data up to date on any state-required website. They'd have to deduct employee contributions with payroll, remit those contributions to the state. So essentially, not really any financial impact because employers don't have to make any contributions. There's no employer match required here, but they do have that administrative piece that is required for them to do. Of course, employees are not required to participate. The enrollment is automatic, and every state designates what that automatic percentage of withholding is. But those employees can, of course, opt out at any time and opt in again at any time. So though the employer impact may potentially be minimal, there is potentially a large impact on employees. A Deloitte Global study estimated that the retirement gap, that difference between what retirees will need and what they have saved, they estimate that to be at $3.68 trillion. So definitely an issue, but research has also shown that employees are more likely to save if they have access to a retirement plan at work. So that is the direction that states are going in. So which states does this happen? These are the states that currently have active state-sponsored plans. California, Colorado, Connecticut, Illinois, Maryland, Massachusetts is actually currently required for nonprofits only. And Washington is right now, it's not a mandated plan, but they have set up like a retirement plan marketplace, similar to what you may be familiar with the healthcare marketplace created under the Affordable Care Act, where employers can go in, employees can go in and compare plans and pick a health insurance that works best for them. Washington set up something like that for employers for retirement plans. So they can go in, select, and set up a plan easily. And there are a number of states that also have passed legislation that will be going to effect in the future, and as well as localities. So definitely something to keep an eye on in the states where you operate, because we can expect more states to pick up on this trend in the coming months and years as they look to the future and a better future for the people who work in their states. Our second state trend is paid family and medical leave, or PFML for short. PFML is paid time away from work due to circumstances that require a longer term period of absence than a typical employer's regular sick day policies offer. The family leave portion of the leave would generally be used to care for a new child or to care for a sick family member. And the medical leave portion is generally time off to care for one's own serious illness. Now, of course, it's going to vary by state about the specific reasons that an employee would be eligible to take the leave, but those are generally what they're used for. Now, what about federal leave? Are there any protections on the federal side? Yes, they do exist. The Family Medical Leave Act, which was signed into law under the Clinton administration in 1993, does provide 12 weeks of job protected leave for essentially pretty much the same reasons as many of the state PFML laws do. However, that leave is unpaid. So if an employee wants to take it, it would be on their own dime. Another limitation of FMLA is that it only covers employers with 50 or more employees within 75 miles of the employee's work site. And in addition, an employee has to work for an employer for at least 12 months and for at least 1,250 hours in those 12 months immediately preceding the leave. Though the Department of Labor has published statistics that they estimate about 44% of U.S. workers are not covered under the Federal Medical Leave Act and are therefore not entitled even to unpaid job protected leave, let alone paid leave. So states are really stepping up to fill in the gaps of FMLA. Of course, again, as I said, those requirements are going to vary by state in terms of everything about who is eligible, the reasons that an employee can take leave, the amount of leave, the number of weeks. I think the range is usually anywhere from like 4 weeks to some 12 weeks, even longer. And of course, how is that leave funded? Generally these are state mandated programs. They're run by the states. Some are funded by employee withholding. There's a certain percentage taken out of every employee's paycheck, whether you're going to take that leave ever or not. Some are funded only by employer contributions. Employer are carrying the responsibility of paying for this leave into the state fund so that employees can get these benefits should the need arise. Though most states take a combination approach where there are both employee withholding as well as employer contributions. So again, definitely going to vary by state. Some states even have a different setup where the state itself doesn't actually handle the funds coming in or the payments out. They require that an employer actually set up with a third party, similar, let's say if they have a disability provider, they would have a paid family and medical leave provider, also a third party where premiums would be paid to that third party, and the third party would pay out benefits when there are claims from eligible employees. So these are the states that either have active or upcoming paid family and medical leave requirements. New Hampshire, Vermont, and Virginia, you can see are little marked on this slide with little stars because they are different in that they're actually not mandatory, but these states have gone in direction of creating voluntary programs. So employers are not required to participate, but the programs are there should they choose to opt in so they can offer these benefits to their employees. Of course, these requirements are going to vary by state, so be familiar with yours. There are always new states who are passing these laws. It's a very popular trend, and we can expect that this list will increase as we move into 2024 and into the coming years. Just want to mention one other thing that, a little bit of a comparison between the paid family medical leave and the FMLA on the federal side. On the federal side, the law, in order to get that unpaid leave, those 12 weeks, to care for a family member, they define a family member as a child, spouse, or parent. While under state paid family medical leave laws, those definitions are going to vary by state and what's considered a family member, and they're generally much more expansive than FMLA. So definitely something to just be aware of and be careful that you are aware of who your employee can take that leave for. Because under federal law, it's very limited. Under state law, it can include things like step-parents, grandparents, domestic partners, and for some, even any blood relatives. So definitely something to be on top of. I also don't want to confuse anyone with state earned sick leave. Earned sick leave is a different topic, which we're not covering today. You can definitely visit Viventium's website. We have webinars on earned sick leave. We also have webinars with more details on paid family and medical leave. So if you want to learn more, definitely go there. Earned sick leave is something else. Earned sick leave is generally where employees can accrue paid leave as they work, generally for more short-term needs, doctor's appointments, someone's not feeling well, someone's child's out of school because they're sick, things like that. Short-term leave, those accruals are generally capped somewhere between 5 and 10 days annually. So that's a different requirement, also a popular state trend, not to be confused with the paid family and medical leave. So let's finish off with our last item on the agenda, some pay strategies. Strategies that relate to worker retention, satisfaction, and loyalty, as well as compliance, because really I see those as all as intertwined. And when we're talking about pay strategies and worker retention, what I really want to focus on from the payroll compliance perspective is the importance of pay accuracy. Getting payroll right each and every payday so that you're ensuring that your employees are confident in their pay. This is going to be the most basic form of trust between the employee and employer. This is where it all starts. It's the foundation of employee loyalty. They need to know what they're getting. They need to understand what is going to their pay that is fair and it is compliant. Because honestly, if someone doesn't understand what's going to their pay or think they're getting what they're owed, no one's staying at that job, right? So making pay accuracy and employee understanding really a top priority is going to be key to worker retention. It's also going to be a way to enhance your communication with your employees. There should be open channels of communication between employees and an employer about changes to pay, any laws that are changing their pay, as well as a process for employees to ask questions and get clarity about their pay. And really an important communication tool, which seems kind of basic, but if we think about it a little more, it's so powerful, is the employee pay stub. Because if a pay stub is clear and accurate and breaks down the details for employees and displays, of course, all the items that must be included by law, whether on the federal level or on the state level, but also additional information just clearly laid out to give employees that entire picture. That is really going to go a long way in terms of giving the employees the confidence and satisfaction in their pay. However, pay accuracy is not so simple, as I'm sure we are all very familiar with. It is hard to achieve and can be challenging because there are so many regulations out there on the federal level, on the state level, on local levels, and the world of compliance is constantly changing. And there's so much to stay on top of. And just on this slide, I just put up here a few of the compliance areas that affect the health services industry. On the federal side, of course, FLSA overtime provisions, which of course we might be seeing some changes to. We have to make sure hours are tracked accurately, overtime is paid correctly. Often in the post-acute care space, we see retroactive pay coming into place where worked hours are reported late. And in that scenario, if there's overtime involved, it must be calculated and based on the hours for the week in which that overtime was worked, not when it was reported, if it was reported. late. So we have this retroactive overtime coming into play. In addition, a lot of times in the post-acute care, we see employees paid at different rates for different types of work, and therefore overtime must be paid at a blended or weighted average rate. On the other side, on the state level, some states have passed daily overtime requirements. They have rest overtime pay requirements. Sometimes there's even double time pay coming into place in some states. A big item on the local level in terms of pay accuracy is local taxation, which can get complex in many states, definitely in Pennsylvania. We're all familiar with that. And it's so important that every employee has the correct taxes set up from the get-go so that their tax payments, their net pay is so accurate and no, because first of all, no employee wants to receive a surprise tax bill at the end of the year because their taxes were either withheld at the wrong rate or paid to the wrong jurisdiction. But even overpayment. Many healthcare workers live paycheck to paycheck, and having too much tax withheld could put them in an extremely difficult situation as well. So accurate taxation, again, number one, is a must. To add to that list, we have states with wage parity requirements. Employees have to pay employers a certain minimum pay and benefits, spread of hours, split shifts, things like that, which get complicated. It's a lot to keep track of, but being on top of it is really a top priority because once an employee catches an incorrect paycheck, it's really hard to then go back and rebuild that trust. There's no room for error. The stakes are high. And not getting into the aspects of labor audits and penalties, which of course do exist, solely from an employee satisfaction and trust perspective, employers really need to ensure that they have systems and structures in place to pay their employees correctly now and in the future as we see continued changes to regulations. So how do we ensure that pay accuracy is achieved in a world of compliance that is always evolving? So there's two sides of the coin here. First, you need reliable resources of information. Of course, information that is relevant to you based on where you operate and your industry. Of course, be a regular visitor to your state government websites. Be sure you're on top of the latest developments. Many states have email subscriptions you can sign up for to get updates. Keep yourself educated like you're doing today. Attend webinars, conferences, stay on top of the latest developments. Make sure to subscribe to a reputable source for ongoing pay updates. There are many companies out there you can partner with to make it, and they make it their business to be on top of the latest developments, and you can be a subscriber. And last, make sure you have people who are there to support you, who know what they're talking about, partners who are compliance experts who can work through the details and provide you with the information that is relevant to you as well as you develop your best practices to stay on top of compliance changes. And then the second side of the coin is going to be technology. Technology that is going to work with you and simplify things and not make things more complicated. Technology that's going to achieve that accurate pay, that is going to have automatic pay calculations that keep you in compliance with those complicated overtime and retro overtime, blended overtime, as well as any other requirements like daily overtime, day of rest, spread of hours. Geolocation, geotax setup is an really key feature, which is going to ensure the correct taxation from the get-go. This feature would look at employees' work address and their resident address and ensure that taxes are set up from the beginning, first date of hire, first pay date. And of course, having software that has rule-based and date-effective settings in the software to ensure the proper rules kick in at the correct times. Technology is really going to be key here. You need software that definitely is going to simplify the process, take out that manual work, reduce errors, and make for, first of all, a more accurate, efficient process, but also an experience for our workers that is easy, that is simple, where they understand their pay, it is clear to them, and they have that trust and confidence in their employer and in their pay. So with that, we are going to go over to some questions that have come in. We have a few minutes left.
Yeah, it looks like one came in, rather than utilizing the chat, it looks like someone submitted a question using the Q&A.
Okay. Let me see if I can pull that up here. Okay. Yes, I see it. Thank you, Kimberly. Is the new I-9 form required by all states, including Pennsylvania, or is this impacted only by pay transparency laws, which PA does not participate in? Yes, so that's correct. Pennsylvania does not yet have a pay transparency law. The new form I-9 is required by all states. It's actually not a state form, it's a federal form. So on the federal government level, everyone that is hired as an employee needs to have that new Form I-9 submitted, completed. That has always been in place. Of course, right now, as of November 1st, the new version of the form must be used. So yes. Was that it?
And that looks like all of the questions that were submitted. As always, if anyone who is within the webinar, if you feel more comfortable submitting your questions via email, feel free to reach out to myself, kchalia@phca.org. And do you have your email that you could share in the chat?
Yes, I will
Okay,
put
great.
my email in the chat right now, and please feel free to reach out if you do have any questions now, or if you think of anything in the future. I'm happy to help with that. Or you can definitely find out more information at viventium.com.
All right, perfect. And once again, thank you so much, Malka, for this wealth of knowledge today. We appreciate you. And I will give everyone back 4 minutes of their day.
Okay, thank you, Kimberly, and thank you all for joining.
Thank you.